AI is fundamentally changing healthcare product management, and if you're not paying attention, you are going to be left behind. In the next 13 minutes, I'm going to show you exactly what's changing, what skills that you need, and why this is actually the very best time in history to break into healthcare product management. Hey, I'm Jennifer Rist. I'm an AI-certified senior global platform leader. I've spent the last 15 years launching healthcare products, and I can tell you with absolute certainty that the healthcare product management role today is completely different than it was even 2 years ago. And it's all because of AI. AI isn't replacing healthcare product managers. It's creating more opportunities, better products, and honestly, it's making the job a lot more interesting than it ever has been. So today I'm going to break down the 5 biggest ways that AI is changing healthcare product management, new skills you need to develop, why this creates massive opportunity for people breaking into the field, and what separates AI literate product managers from everyone else. And if you stick around to the end, I'll tell you the one thing that you could do this week to start positioning yourself as an AI-capable healthcare product manager. So let's dive in. First, let's get real about what's happening. Every healthcare company I talk to, everyone from Epic to some tiny digital health startups, is either building AI products, they're integrating AI into their existing products, or they're evaluating AI vendor solutions. According to recent data, 73% of healthcare organizations are piloting or implementing AI solutions. Healthcare AI market is projected to hit around $188 billion with a B by 2030. And AI healthcare product management job postings are up by over 340% year over year. This isn't just hype, this is reality. But here's what people get wrong. They think AI is going to replace their product management roles, and that is not what's happening. AI is creating new types of product management work, and if you understand what's changing, you can position yourself as the front of this wave instead of getting left behind. So let's talk about what's actually changing here. Here are the 5 biggest shifts that I'm seeing in healthcare product management today because of AI. And I'm not talking theory here. This is what I'm experiencing every day in my corporate role, what I'm seeing when I mentor other product managers, and what's showing up in job descriptions for healthcare product management roles. So let's go through them. Change number 1 is AI is no longer a nice to have. It's becoming a core product feature. So 5 years ago, if a healthcare product had AI, it was a huge differentiator. Now it's table stakes. So electronic health records, when you look at those, right, they need AI-powered clinical decision support. Patient portals, they need AI chatbots for triage and appointment scheduling. Medical imaging, AI-assisted diagnostics. Maybe care coordination platforms, predictive analytics for readmission risk. So what this means for healthcare product managers is that you're no longer managing just software features. You're managing AI models, data pipelines, model performance, and continuous learning systems. Traditional product managers may look at their features when they're doing requirements and say, we need a search feature, right? An AI product manager needs to also include some verbiage saying, maybe we need an AI-powered search that learns from user behavior, personalizes results, and improves accuracy over time. See the difference? It's a lot more detailed, and there's a lot more items on the list that we need to add to our requirements as adding in AI to software. So as a product manager, you now need to ask questions like, what data do we need to train in this model? How do we measure model accuracy? How do we handle bias potentially? What happens when the model makes a mistake in a clinical setting? And how do we explain AI decisions to clinicians who need to trust the system? Because although healthcare organizations are talking about AI, not all the staff and clinicians that are using these tools trust AI right now. This is a totally different skill set. And if you're not developing it, you are going to struggle to compete for product management roles in the next 2 to 3 years. But don't panic. We'll talk about how to build these skills in just a minute. Change number 2 is that you're managing entirely new stakeholders, and they speak a different language. As a traditional healthcare product manager, your stakeholders, they were clinicians, IT teams, compliance, legal, sales and marketing, and maybe some executives. As an AI healthcare product manager, you need to add on top of all of those, you have data scientists and machine learning engineers. You have ethics committees specifically for AI. You also have clinical validation teams, regulatory affairs. So now really have to think, is this product FDA regulated where maybe it wasn't in the past? You need that FDA, AI, and machine learning guidance. And also AI vendor partners. So you may also be bringing in some third-party vendors that are working with you in creating many of your software tools. And here's the challenge. Each of these groups speaks a completely different language. Data scientists, they talk about precision, recall, F1 scores, overfitting. You have clinicians talking about sensitivity, specificity, positive predictive value, and regulators talking about predetermined change control plans and algorithm change protocols. So as your job as an AI healthcare product management evolves, you are the translator to all of this chaos. You need to understand enough to have credible conversations with data scientists about model performance without needing to build models yourself. So you don't have to be an expert in all of this, but you need to understand the lingo. You need to explain AI outputs to clinicians in terms that they trust. And you need to navigate FDA guidelines and guidance on AI and machine learning on medical devices. Whether or not yours is or not, that's to be determined, but you may be in a situation where it never was before, and now it's crossing those boundaries, and you need to take that into consideration. This is hard, but it's also what makes you valuable. And if you don't grow, you are going to die on the vine. If you can manage AI stakeholders effectively and efficiently, if I could get that out, you can become indispensable. Change number 3, you're measuring success differently, and traditional product metrics aren't enough. So in traditional product management roles, you track user adoption, engagement, retention, NPS scores, revenue. But for AI products, you also need to track another tracking sheet, right? Model accuracy and performance. So you need to know precision, recall, area under the curve models, prediction confidence levels, false positives or false negative rates. This is critical in healthcare. You're going to need to know model drifts over time, bias and fairness potentially, those metrics that go across maybe patient population health type of software, and clinical outcome impact. So did AI actually improve patient care? Let me give you an example. You're building an AI model to predict maybe no-shows for appointments. Traditional product management metrics might say you need great adoption, the clinics are using it, right? But when you dig into the AI metrics, you find that the model was significantly less accurate for patients from certain zip codes. Why? The training data may have been biased. So if you only looked at the traditional product metrics, we would have missed this, right? But because we're maybe tracking AI-specific fairness metrics, it can be caught up front and fixed. So you need to be tracking everything, including when it fails and what to do next. As an AI healthcare product manager, you need to be fluent in both traditional product management and product metrics, and also AI performance metrics. And in healthcare, this matters even more because AI mistakes can affect patient safety. So let's look at change number 4 now. Regulatory complexity just went up by 10x, or I feel like 100x. Healthcare was already heavily regulated. You're now adding in AI. It's a whole new level of regulation. The FDA now has specific guidelines for AI and machine learning medical devices. Key concepts that you need to understand as an AI healthcare product manager are that software as a medical device, or SAMD as they're terming it. Is your AI product a medical device? You need to know. You need to know if it's crossing the line, and this will determine your regulatory path. You also have predetermined change control plans. So how do you update AI models without going through a whole full reapproval process every time? You also have algorithm change protocols. So your plan needs to be solid on how the AI model will evolve and improve. And you have real world performance monitoring. That's really imperative. You can't just launch an AI product and walk away. You have to continually monitor its performance in the real world and with your customers. Here's why this matters. If you're a product manager at a company building maybe AI clinical decision support, you might need FDA clearance. And maybe you haven't in the past, but you're crossing that line now using AI. If you don't understand the regulatory pathway, you can't build a realistic roadmap. You can't set proper timelines, and you can't manage stakeholder expectations. I've seen startups waste millions because their product managers didn't understand the FDA AI guidance and promised features that required regulatory approval that they didn't account for. So even if today you're managing a product that is not AI heavy and has not been regulated, please look into it with your regulatory group to see if the tides have changed, because that will be imperative. Now, do you need to become a regulatory expert? No. By all means, no. Leave it up to the experts to do that. But you do need to know enough to ask the right questions and to work effectively with your regulatory team. So now you have to have a tighter relationship with them. This is what separates good AI healthcare product managers from great ones. So get the right people in the room. I know in the past, bringing in legal, bringing in regulatory wasn't a big thing. Now it's even more important. Change number 5 is your ethical responsibility just got 10x heavier, 100x heavier. Here's the thing about AI in healthcare. When you build an AI product that helps diagnose disease, predict patient risk, or guide treatment decisions, lives are on the line. And AI models can have bias. They can be wrong, and they can fall in unexpected ways to failure. As a product manager, your responsibility is for bias mitigation, so ensuring your AI doesn't work better for some patient populations than others. The explainability side, can as clinicians understand why AI made a recommendation? If they can't, they're not going to trust it. There's also transparency, being honest about what AI can and cannot do, not over-promising. So over-deliver on what you say it will do. And you have to have fail-safe. So what happens when AI gets it wrong? How do you protect patients? As an AI healthcare product manager, you have to think about all of this stuff. It's not optional. You have to ask, is our training data representative? Are we testing across diverse patient populations? Do we have the right clinical oversight? And are we being transparent about the limitations of our solution? Look, this responsibility can feel heavy, but it's also what makes work meaningful. You're building products that can genuinely improve patient care. And if done right, that's why I love being around customers and just really getting them involved to really understand what we're building and why, and if it's impactful. They're going to be the ones that will tell you. But that's why I love being in this AI healthcare product management space. All right, so that's the 5 changes. Now let's talk about what you need to do about it. So AI is changing everything. What do you actually need to know? Here's the good news. You don't need to become a data scientist. You don't need to code machine learning models. You don't. You don't need to be an expert in everything. But what you do need to do is what I call AI literacy for product managers. Skill number 1 would be a conceptual understanding of what AI and machine learning is. So you need to know what supervised and unsupervised learning means, what training data is and why it matters, how models are evaluated for accuracy, precision, and recall, what overfitting or underfitting means, some common AI and machine learning techniques like classification, regression, computer vision, some of those terms. So you need to start to get yourself familiar with that. So you don't need to build models, but you need to have intelligent conversations with your data science team, your R&D team, and the customers that you are serving. Skill number 2 is prompt engineering. So we're hearing a lot about prompt engineering these days, right? Well, it's going to hit you too. If you're using AI tools like ChatGPT, Claude, or other healthcare specific AI, you need to know how to write effective prompts. This is a skill, and it's one of the easiest ones to develop, but you need to focus on it, asking the right questions. You cannot treat these prompt engines like Google. You need to ask the right questions. So really be thoughtful about what you're asking when you're digging into those AI applications for writing effective requirements or whatever you're using them for. Skill number 3 is AI product requirements. So writing requirements for AI product is different. You need to specify training data requirements, model performance thresholds, bias mitigation strategies, explainability requirements, monitoring and maintenance plans. Skill number 4 is AI vendor evaluation. So you need to know how to evaluate AI vendors, what questions to ask, what red flags to look for, because a lot of vendors will say that they use AI, but the quality varies wildly. So be cautious. Skill number 5 is understanding healthcare specific AI challenges. So this is where you need to look at HIPAA compliance with AI, FDA regulation with AI medical devices like we just talked about, clinical validation requirements, bias in healthcare AI, and explainability for clinicians. All of these skills can be learned, and most of them can be learned in 3 to 6 months while you're still in your current role. You don't need to quit your job or go get a PhD in machine learning. You just need to be intentional about starting to build these skills. So how do you build them? I'll cover that in future videos, but the key is start now. Don't wait. So I've thrown a lot at you. AI is changing this role completely. New skills are required, and there's a lot more complexity. So you might be thinking, excuse me, this sounds hard. Maybe I should just stay in my current role. Well, let me tell you why that would be a mistake. This is the best time in history of healthcare product management to break into the field or to advance your career. And here's why. Companies are desperate for AI literate healthcare product managers. The demand so far is ahead of supply right now. If you have healthcare domain knowledge and AI literacy, you can write your own ticket. Also, salaries will become premium. AI healthcare product managers, they pay about 15 to 25% more than traditional healthcare product management roles. And you're getting in early, maybe. I mean, AI has been around for quite a while. AI has been a hot topic for a while. But the longer that you wait, the more behind you will be. So most healthcare product managers, they haven't developed AI skills yet, especially in healthcare, because healthcare kind of falls behind a lot of other industries when it comes to technology. But if you start now, you will be ahead of 90% of the competition in the next 6 to 12 months. And new roles are always being created, right? Companies are creating roles around AI that didn't exist 2 years ago. Things like AI product manager in healthcare, or clinical AI product lead, or AI ethics product manager. Conversational AI product managers for healthcare chatbots. So we're even creating product managers specifically for those chatbots now. And this space is genuinely exciting work if you love it. This is the space that I love and I love to build in. So for me, all of this is super exciting. But you're building products that are cutting edge technology. You're improving patient care. How cool is that? And you're bringing all of your customers and those clinicians that might be skeptical along the way with you to learn and grow with you and your products. So yes, AI is changing healthcare product management. Yes, you need new skills. But this is opportunity, not a threat. So do not fear. We're not fearful people here on this channel, right? We look at opportunity. So if you embrace the shift, you're going to be so much more valuable, better paid, and honestly, you're going to have a lot more fun. So here's what you should do this week. Start positioning yourself as an AI-capable healthcare product manager by starting to use these AI tools in your current work and taking maybe a free AI course. There's so many out there, like Google's AI Essentials, Coursera's AI for Everyone, and Fast.ai's Practical Deep Learning. They're all free. Go check them out. You don't need a certification. Just build conceptual understanding and update your resume and LinkedIn. Add phrases like AI literate product manager or experience with AI powered products or prompt engineering for product requirements. Even if your skills are just at the starting level, you can signal that you're developing these skills. And follow AI healthcare news. There's a lot out there. Healthcare IT news, the Healthcare AI report, AI in healthcare on LinkedIn. It is everywhere. I think we're being flooded with AI tools right now. And network with AI healthcare product managers, people that are already doing this. So find people on LinkedIn who are already doing the job and ask for information. Maybe, you're not looking for a job. Don't put yourself out there like that and scare them, but ask for 15 minutes. I'm sure that they would be happy to give it to you because there's a lot to learn from them. So that's it. 5 actions. You can do all of them this week. And if you do, you will be ahead of 90% of healthcare product managers who are just ignoring this shift because they're comfortable. So the question is, are you going to embrace AI or are you going to get left behind? So let me know in the comments. I hope that you found this helpful. I hope you found it valuable. If you did, please consider sharing, please consider subscribing, and start using these AI tools. Start learning the basics. Start positioning yourself for success. Do that in the next 6 to 12 months, you'll be in a completely different place in your career. I guarantee it. And we will see you all on the next video.